My name is Jason Wertheim. I'm an assistant professor of surgery at Northwestern University in Chicago. I see patients with organ dysfunction on a daily basis. So I see their deterioration in their capacity to do what they want to do. Patients with kidney dysfunction require dialysis 3 times a week sometimes. Liver dysfunction is very debilitating. We're very highly successful in solid organ transplantation. The patient and graft survival for many of our organs at 1 year is over 90%. Consequently, we have a rising number of patients who need organs for transplantation. We hope one day we could solve the organ shortage problem and develop organs on demand for patients who need them. The main focus of my laboratory right now is to understand how cells function in 3 dimensions. We use scaffolds to develop organs and use that as a blueprint to guide cells to repopulate scaffolds to one day develop a functional organ. If we can deliver stem cells or progenitor cells to the scaffold will instruct those cells to differentiate into more mature cells based upon their location within that matrix. The scaffolding contains growth factors. These growth factors are instructive to cells to promote their differentiation into more mature cells. If you inject a suspension of individual cells within our scaffolding system, those cells will then come together and coalesce and form cell-cell junctions. We utilize iPS-derived hepatocytes to develop stem cells or progenitor cells from a potential recipient patient. We would also look at primary cells from patients or from animals. And there's also cell lines as well. But there's drawbacks to a lot of different sources of hepatocytes. Primary cells are difficult to obtain. Cell lines are very difficult to control in terms of their growth and proliferation. So that's why we focus pretty much on induced pluripotent stem cell derived applications. My laboratory has been very happy with the iPS-derived hepatocytes that we've tested in our culture system from Cellular Dynamics. Their support system has been phenomenal in terms of lending technical advice and culturing the cells and providing suggestions and recommendations on how to maintain the cells in our facility. The benefit of those cells is that they are homogeneous and come to us with a very high purity. And the support that we've had both in person in training how to use the cells and also technical support over the phone has been outstanding. I think the application of regenerative medicine in general to healthcare is already here. It's already been realized. Tissue-engineered trachea, tissue-engineered bladder, tissue-engineered blood vessels, regenerative medicine in general, and the technology of induced pluripotent stem cells can help move organ engineering forward to one day develop replacement tissues and organs for patients who need them.